This video is going to walk through the hospital ER tracking assessment. So I'm just going to start with entering my name, Kathy. And we'll go ahead and start with question number 1. Tracking patients who have been seen in the hospital ER is necessary to close the loop on the patient's care, to save the patient a trip to the hospital or ER later, to keep the provider updated on the patient's status, or all of the above. That answer choice should have been all of the above. Number the items below in order of occurrence. So what's going to happen first is the patient is going to be seen in the hospital ER. Next, the hospital ER should send documentation of that visit. Once that's been completed, medical records will receive that information and they will document that into the tracking tool. If a follow-up appointment is needed, the care team will be notified and the care team will schedule that appointment. Scroll down. So number 3, check which of the following is needed for ER visits in the tracking tool. We have date of visit, time of visit, chief complaint, urgency or acuity level, ER location, if the patient was admitted, patient name, age, and date of birth, payer source, last appointment date and type, and with which provider, their ACO status, whether or not the patient is new or established, or D, all of the above. And we are trying to gather all of this information, so it's going to be all of the above. Number 4, for hospital visits, the admit and discharge date should be entered into the tracking tool. That is true. We won't always have a discharge date, but ideally we would want that in there. Number 5, which of the following visit types are acceptable as the patient's last appointment? So when we're looking at the patient's last visit and what the visit type was, any of these are acceptable. So your annual physical well child, your ECP, ACC, established care with provider and acute care visit, your revisit and follow-up, and any prenatal appointment. So it's going to be all of the above. Number 6, a patient is considered established if they have been seen within the past 3 years. That is true. If the patient is not in our system, a new chart needs to be created. That is false. Remember, from the fax inbox, we can send that document to the hospital ER inbox, but we don't have to attach it to a chart. We do need to add a description and include a note that states the patient is not in our clinic system. Number 8, which of the following payer sources are documented into the tracking tool? Private, Medicaid, Medicare, uninsured, or all of the above. We're going to use each of these categories, so all of the above. If the patient does not have a follow-up scheduled, send a telephone encounter to the care team. That is true. If the patient has a follow-up scheduled, the care team does not need to be notified. We will simply send the document to the provider. Number 10, a follow-up is needed when the patient has an acuity level of 1, has an acuity level of 2, or had an acuity level of 3, and a chronic condition such as diabetes, hypertension, or congestive heart failure. And that's going to be all of the above. Each of these patients will require a follow-up. Number 11, which of the following are considered non-emergent? So that's going to be our patients that had an acuity level of 5, of 4, or level 3, but did not have a chronic condition documented. So that's going to be all of the above. Please give me a call if you have any questions, and thanks for listening.